Bad breath can have a big impact on our interpersonal relationships and opportunities in general. Sometimes it becomes a barrier, preventing us from finding a common language with other people. Today we are going to talk about this important topic that concerns many people. Bad breath, or otherwise known as halitosis, not only can create unpleasant moments, but also indicate various health problems. Let's understand why it's such a big deal and what you can do to get rid of this problem. Don't go far. It will be interesting. Bad breath can have many different causes, and their percentage can vary depending on the specific situation. First, let's divide them into two groups: oral problems, that is physiological, and problems related to medical as well as emotional factors, that is external. Physiological factors are approximately 80% of the causes. First of all, it is poor oral hygiene. Improper brushing of the teeth. Tongue and gums can lead to the growth of bacteria that cause bad smell. Brush your teeth twice a day with a soft toothbrush, and use toothpaste with Flourmid. Flourmid helps repair weak or damaged tooth enamel and prevents the development of small cracks. It reduces tooth sensitivity by restoring enamel. Flourmid helps reduce tooth sensitivity to cold and hot, sweet and sour. Brush for 2 minutes, remembering to brush your tongue and the inside of your teeth. Change your brush regularly and ensure proper brushing technique. It is recommended that you change your toothbrush about every 2 months. Also, replace your brush after a cold or illness to prevent reinfection. The next factors are cavities and dental problems. Besides visiting the dentist regularly for preventive checkups and teeth cleaning, you should also know where tooth decay comes from. Sugar and sweets can contribute to tooth decay due to the following processes. The first is the multiplication of bacteria in the mouth that feed on sugar and other carbohydrates. When you consume sugar and sweets, these bacteria break them down and release acids. These acids can erode tooth enamel and create the conditions for tooth decay to develop. These bacteria, while decomposing sugar, then form plaque, which is a sticky coating on the surface of the teeth. This coating is an ideal place for bacteria to multiply and continue the process of enamel decay. As a result, the pH in your mouth also decreases, making the environment more acidic. Acid can damage the enamel and create the conditions for holes to form in the teeth. The normal pH value is between 6.0 and 7.6. This is the healthy level of acidity at which saliva effectively fulfills its protective function, replenishing mineral loss and preventing tooth decay. Bad smell from mouth can be associated with gum diseases, and this is due to the presence of bacteria and their activity. Gum diseases such as gingivitis and periodontitis are usually caused by bacterial infection. These bacteria can multiply and form bacterial colonies in areas where plaque and tartar accumulate. This leads to inflammation of the gums, tissue breakdown, and the release of smelly compounds that cause bad breath. As the bacterial infection progresses and affects deeper tissues, such as bone tissue, the bad smell can become more intense. Therefore, treating gum disease and maintaining good dental and gum hygiene is very important to prevent halitosis and keep your breath fresh. Gum disease can include several conditions, ranging from mild to more serious. The most common gum diseases are gingivitis. This is an inflammation of the gums, usually caused by poor oral hygiene. Gingivitis is manifested by redness, swelling and bleeding of the gums. Periodontitis. This is a more serious condition, in which inflammation spreads to the supporting dental tissues, including bone tissue. Periodontitis can lead to tooth loss if left untreated. Gum recession. This is a condition in which the gums begin to recede, leaving the roots of the teeth exposed. This can lead to increased tooth sensitivity and other problems. The next factor is dry mouth. Dry mouth can be caused by a variety of factors, and bad breath is often associated with this condition, as saliva can't manage to clean bacteria from the mouth. Here are some of the possible causes of dry mouth. and associated smell. Medications. Certain medications such as antidepressants, antiseptics, and many others can cause dry mouth and resulting bad breath. Respiratory diseases. Dry mouth and bad breath can be associated with respiratory diseases such as rhinitis or sinusitis, which can make it difficult to breathe through the nose and switch to breathing through the mouth. When a person breathes through the mouth, it can lead to increased moisture loss from the mouth, which can cause dryness, while breathing through the nose can be controlled during the day. Many people breathe through the mouth during sleep, especially if they have sleep breathing problems such as apnea or snoring. Saliva deficiency. Saliva plays an important role in keeping your mouth moist and fighting bacteria. If you have a lack of saliva, it can lead to bacteria growth in your mouth and bad smell. First and foremost, when treating dry mouth, it is important to drink enough, preferably 2 liters of water or unsweetened tea a day. In addition, vigorous chewing promotes the secretion of saliva. That is, food that needs to be chewed thoroughly is better for the teeth than soft food. There is a general recommended approach to chewing food, and while there is no exact number for how many times you should chew each piece of food, it is generally believed that chewing food 20 to 30 times before swallowing is a good standard. However, this number can vary depending on the type of food and individual preferences. It is important to chew food long enough for it to become well crushed and mixed with saliva. This helps the digestive process, improves nutrient absorption, and reduces the strain on the stomach and digestive system. Chewing also promotes a better feeling of satiety, as it takes time for the brain to realize that the stomach is full. Diet. Some diets, including low-carbohydrate diets or constant chewing of sugar-containing gum, can cause dry mouth and change the chemical balance of the mouth, which can contribute to bad breath. And last but not the least, stress and anxiety can affect saliva composition and cause bad smell. External factors such as tobacco and alcohol consumption, as well as certain food such as garlic, onions can leave a bad smell in the mouth. Besides rinsing and cleaning your mouth, chewing cloves is a good remedy. Cloves have a strong aroma and flavor that can help mask the smell of garlic. Also chew fresh parsley. Parsley tends to neutralize odors. Medical problems. Rare medical conditions such as diabetes, acid reflux, or respiratory tract infections can be the cause of halitosis. Let's talk about these in detail. Many people with diabetes notice that they produce less saliva and experience dry mouth. An increase in blood glucose levels is accompanied by profuse urination, dehydration, and therefore thirst and dry mouth. In addition to a decrease in salivation in patients with diabetes, the composition of saliva changes and increases its glucose content. All this creates favorable conditions for the development of dysbacteriosis in the oral cavity. The number of dangerous microbes that cause inflammation ceases. Lingering in the oral cavity, bacteria begin to actively multiply, consume food residues, and in the process of their vital activity emit bad-smelling compounds, like rotten eggs. Plaque should be removed every 12 hours to avoid infection in the oral cavity, thus avoiding bad breath. Gastroesophageal reflux, or GER, is a condition in which stomach contents, including gastric juice and food debris, back up from the stomach into the esophagus. When acidic liquid from the stomach travels up the esophagus and reaches the mouth, it can cause bad breath. This is because the acid and food debris can have a distinctive odor that carries over to the air you exhale. GER disease can have a variety of causes, including increased abdominal pressure, for example, pregnancy, obesity, or lifting weights can increase pressure in the abdomen, which contributes to reflux. Anatomical abnormality. Some anatomical features, such as a hernia of the esophageal opening of the diaphragm, the passage through which the esophagus passes, can contribute to reflux. Weakness of the upper gastric sphincter. This sphincter ring muscle, which is at the end of the esophagus and adjacent to the stomach, must be strong enough to prevent the backward movement of stomach contents when you swallow. The ring band of muscle around the bottom of the esophagus relaxes, allowing food and drink to enter the stomach. The sphincter then closes. If this sphincter does not close properly, stomach acid can back up into the esophagus, causing inflammation. This can be due to either high or low acidity in the stomach. Another common reason that can cause bad odor from the stomach is gastritis. This is an inflammatory disease of the inner surface of the stomach. It appears due to various factors, including Helicobacter pylori infection, use of non-steroidal anti-inflammatory drugs, stress and poor eating habits. In the chronic course, the mucosa becomes red, swollen and poorly functioning, hence the disgusting smell. The odor can also be from ulcers that have developed in the stomach. Let me share you about the experience of one of our patients whose bad breath was related to gastrointestinal tract.
For many years I worked in an office, working hard to achieve results, often neglecting my health. Liters of coffee would keep me going for the rest of the day, and lunch breaks were reduced to a few minutes because work was more important than anything else. I must say that I didn't pay much attention to these signs until I started dealing with my personal life. That's when I was told about bad breath, especially when I was hungry and I had no oral problems. After studying the medical literature and researching everything on the internet, it became clear that I had developed a combination of factors that caused this problem. Determined to make a change, I turned to you. After counseling, I gave up coffee and other irritants, started chewing my food thoroughly to balance the acidity in my stomach and speed up digestion. I also started drinking chamomile tea with apple cider vinegar in the morning and evening and drinking cabbage juice on an empty stomach. After 2 to 3 days, I was surprised by my girlfriend's words. The bad breath was gone. This moment made a huge difference in my personal relationships and my overall health. My experience has shown that even small changes in lifestyle and diet can bring positive results. Remember, taking care of your health and eating right can greatly improve your quality of life. Thank you.
We too are proud and glad that one more person's life has changed in a good and healthy way. So, pay attention to all your body's signals. It will give you the opportunity to be healthy and not miss the chances that life presents you. For more information or consultation, you can contact us on our Telegram, Instagram, and Facebook pages. Links can be found in the description below this video. Subscribe to our YouTube page and share your comments. Specify your questions and topics of interest in the comments. Thanks for watching. Stay healthy.